Good afternoon. Welcome to the daily briefing in St. Clair County, where I'm joined with Chairman Kern and also Sam Bierman from the Health Department. Sam, looking better on the numbers.
We are.
So, like you said, there is really no bad because we've been preaching more testing, so we expect those numbers to go up.
We did, and they're certainly better than yesterday, and I think if we keep heading in this direction, we will all be happier.
Okay.
So as of today, 8,798 tests have been performed in St. Clair County, with 1,404 positive test results, with an increase of 42 from yesterday, and that includes both males and females from their teens up to their 90s. We are at 7,541 negative test results, with 33 results that are still pending. Unfortunately, we are announcing 2 additional deaths today, which does bring our total for St. Clair County to 104. They were both were males that were in their 70s who both did have underlying health conditions. And as always, our sympathies go out to their families. For those individuals who have completed their 14-day required IDPH quarantine, we are at 881. For state totals, we have crossed another milestone. For the state, we are at 1,919 tests that have been performed, with 125,150, which is an increase of 1,156 from yesterday, with 5,795 deaths, which is an increase for the state of 59 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, we currently have 54 patients that are admitted due to COVID-related reasons, and 5 of those patients are currently on ventilators. For facilities that are in outbreak status, which is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 42 cases and 4 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 12 cases and no deaths. Caseyville Nursing and Rehab has 3 cases and no deaths. Cedarhurst of Shiloh currently has 12 cases and no deaths. Cedar Ridge of Lebanon has 16 cases and 1 death. Colonnade Senior Living in O'Fallon has 4 cases and no deaths. Four Fountains in Belleville has 104 cases and 25 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center in Lebanon has 54 cases and 10 deaths. New Athens Home for the Aged has 51 cases and 3 deaths. St. Paul's Home has 42 cases and 11 deaths. Swansea Rehab and Care Center has 23 cases and 2 deaths. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And now I will turn it over to the chairman for his update.
Thank you, Sam. We'll move into the zip code reports. Remember, if you don't hear your zip code, it doesn't mean that you don't have a COVID positive diagnosis in your zip code. What it means is we haven't risen to the level above 5 yet. So in 62059, we remain at 7. 62201, we go up by 3 to 22. 62203, we go up to 47. That's an increase of 3. 62204 is now at 50. That's an increase of 1. 62205 goes up to 56. That's an increase of 4. 62206 is now at 118. That's an increase of 4. 62207 goes up by 1 today to 78. 62208 goes up by 1 to 83. 62220 goes up by 1 today to 147. 62221 goes up to 116. That's an increase of 4. 62223 increased by 1 to 55. 62226 increased by 5 to 154. 62232 remains the same at 27. 62239 remains the same at 15. And likewise, 62243 remains the same at 8. In 62254, we went up by 6 today to 54. 62257 remains the same at 12. And 62258 remains the same at 15. In 62260, we went up by 1 to 11. 62264 went up by 5 to 47. 62269 went up by 2 to 79. And 62285 went up by 1 to 15. Herb?
Zip code numbers, and Sam, you're right, we passed a milestone statewide over 1 million testing, but we still want testing to go on. And as we said at the beginning, the more tests we recognize, we are going to see possibly more positive numbers. So, our hospitalization numbers went down a little bit, our vet numbers went down, and that's what we want to continue to see. So we keep pushing towards June 26th, and that's what we're doing. I wanted to take just a moment we had talked yesterday about the long-term healthcare facilities, the job that they do and everything, and I saw a post today that we lost a nurse in Clinton County that worked in a long-term healthcare facility, and I just kind of thought that was ironic. We talked about the job that they do in the long-term healthcare, and then we end up losing a nurse who they deemed as a hero, and they all are, as we talked yesterday. So our condolences go out to her family, and we really appreciate all the job that the nurses and the CNAs and the housekeeping, the people who prepare those food for the loved ones in those homes, the job they do, as well as all of our first responders that we each say each day on here. Team St. Clair is what it's all about, and we're all in this together. And as Sam said, and the chairman has said many times, we get these numbers down, we all get back to some normal way of life, whatever the new norm is going to be. That's what we're looking forward to. We've got another order of PPE coming in next week, so we continue to supply that to the first responders and to the hospitals, and some of the new dentist offices called this week and got some of the supplies. So we're here to help all we can. So we'll be back in just a little bit with Cindy and Daisy to translate this into the Spanish community, and we'll be back here tomorrow afternoon at 3:30 for the next update. Keep your fingers crossed. Let's have a good weekend. Let's keep these numbers going in the right direction. Have a good evening.